Hello and welcome to the ICD 10 CM updates presented by CIMC, Chester Interactive Medical Coding Program. Today we are going to review the updates for ICD 10 2025. For 2025, we have 252 new codes, 36 deleted code and 13 revised codes. Also, there's been some minimal changes in the guidelines. Here are the 6 guidelines that have been affected. Section I.C.1 to D.5b. Section I.C.2.E2. Section I.C.2.S. Section I.C.2.T. Section I.C.4.1a. And Section I.21, C.3. Section I.C.1, D.5, B, adds T81.49 and O86.09 to the list of sepsis codes that should be sequenced first. Section I.C.2 to E2 revises the first sentence to reiterate that if a patient admission/encounter is chiefly for the administration of chemotherapy, immunotherapy, or external beam radiation therapy, assign. The keyword here is chiefly, in order to use the specific Z codes based on the type of therapy as the first listed or principal diagnosis. Section I.C.2 to S adds C84.7b to the list of codes to assign for breast implant-associated anaplastic large cell lymphoma. And Section I.C.2 T revises the guideline for secondary malignant neoplasm of lymphoid tissue. Section I.C.4.A1 adds the guideline for E10. Point A, type 1 diabetes mellitus, presymptomatic. This is assigned for early-stage type 1 diabetes that predates the onset of symptoms. Section I.21, C.3 includes a revision to account for the descriptor change to Z17. It now reads estrogen and other hormones and factors receptor status. Now we are going to review the codes and chapters affected by the updates. The descriptor for A77.41 has been revised to the correct spelling of Schaffen's. Just for clarity, Ehrlichia schaffensis is a gram-negative species of rickettsial bacteria. Several codes are converted to parent codes and expanded with 5th character, A, to indicate cancer in remission. For example, under C81 Hodgkin lymphoma, there are 7 new codes that describe the various types of this disease while in remission, C81.0a through C81.9a. Chapter 3. Just one new code is added here, D61.03 Fanconi anemia. What is Fanconi anemia? It's a rare disease passed down through families, inherited, that mainly affects the bone marrow. It results in decreased production of all types of blood cells. This is the most common inherited form of aplastic anemia. Keep in mind, Fanconi anemia is different from Fanconi syndrome, a rare kidney disorder. Under E10 type 1 diabetes mellitus, new codes are added for presymptomatic diagnoses, E10. Point A, category. There are also new codes for hypoglycemia levels, E16. Point A, category. Carcinoid syndrome, E34.00 through E34.09. The obesity section E66 has been expanded to include 4 new codes for obesity class, E66.811 through E66.813, E866.89. The obesity class is organized by BMI. Class 1, 30.0 to 34.9. Class 2, 35.0 to 39.9. Class 3, 40.0 and above. Disorders of citrate metabolism, E74.82 category. Let's make sure we understand citrate metabolism. Citrate metabolism plays an important role in many food fermentations involving lactic acid bacteria. SLC13A5 is an ultra-rare, autosomal recessive, neurodevelopmental disorder that severely impacts cognition and motor control. Lastly, E88.82 obesity due to disruption of MC4R pathway. People with genetic mutation in MC4R, often termed MC4R deficiency, tend to gain weight from early childhood. As such, people can appear big-boned. Under F50 eating disorders, there are several new codes for anorexia nervosa, restricting type F50.010 through F50.019. Binge eating/purging type F50.020 through F50.029. Bulimia nervosa F50.20 through F50.25, and binge eating disorder F50.810 through F50.819. Also new are F50.83 pica in adults and F50.84 rumination disorder in adults. Let's make sure we understand pica and rumination disorder. Starting with pica. Pica is the compulsive eating of material that may or may not be food. The material is often consumed in large quantities without regard for nutritional consequences. Rumination disorder is a functional gastrointestinal disorder defined as the effortless regurgitation of recently ingested food from the stomach back into the mouth in the absence of an organic disease. This usually occurs within the first 15 minutes after the completion of a meal. But how is this associated with mental, behavioral, and neurodevelopmental disorders? Well, rumination is one of the co-occurring symptoms found both in anxiety disorders and depression. And it's often a primary symptom in obsessive-compulsive disorder, OCD, and generalized anxiety disorder. When people are depressed, the themes of ruminations are typically about being inadequate or worthless. There are several changes under G40 epilepsy and recurrent seizures, including the addition of G40.84 KCNQ2, related epilepsy, and 4 child codes, G40.841 through G40.844, to specify whether or not the disease is intractable, with status epilepticus. There are also new codes for serotonin syndrome, G90.81, other disorders of the autonomic nervous system, G90.889, and developmental and epileptic encephalopathy, G93.45. In this chapter, 5 fifth character codes under H44. 2 degenerative myopia are revised to remove the reference to bilateral, eye. For new codes, I26.03 through I26.04, I26.95 through I26.96, expand the I26 pulmonary embolism subcategory and 2 existing codes. I26.93 through I26.94 are revised to add the term thrombotic. Chapter 10, under subcategory J34 Other and Unspecified Disorders of Nose and Nasal Sinuses, there are several new codes for nasal valve collapse. The 6 character codes specify the location of the collapse, internal/external, and the 7th character codes describe state of the condition, static/dynamic/ and unspecified. Chapter 11. In this chapter, there are several new 5th and 6th character codes under K60. 3 anal fistulae, K60.4. rectal fistula, and K60.5 anorectal fistulae to allow the practitioner to report whether the condition is simple or complex, fifth digit, and initial, persistent, or recurrent, sixth digit. Chapter 12. Under L29, there are new codes for cholestatic pruritus, L29.81, and other pruritus, L29.89. And under L43 lichen planus, 6 new fifth character codes more fully describe lichen planopilaris, L66.10 through L66.12, L66.19, and central centrifugal cicatricial alopecia, L66.81, L66.89. Chapter 13. There are several new codes for diseases of the musculoskeletal system and connective tissue. Under M51 thoracic, thoracolumbar, and lumbosacral intervertebral disc disorders, there are new 6 character codes that allow the practitioner to specify the location of pain more succinctly. And under subcategory M65 synovitis and tenosynovitis, several 5th and 6th character codes are added to allow the practitioner to specify the location of the unspecified synovitis and tenosynovitis. Chapter 14. Other than the addition of an excludes 1 note under N39.0 urinary tract infection, site not specified, there's nothing exciting going on here. Chapter 15. This chapter has a few note changes to codes in subcategory O24 diabetes mellitus in pregnancy, childbirth, and the puerperium. Chapter 16. There is the addition of 1 excludes 1 note under P72 other transitory neonatal endocrine disorders. In this chapter, there are 3 new codes for congenital malformations of aortic and mitral valves, Q23, 81 through Q23.82, Q23.88, and 1 new code for Kleefstra syndrome, Q87.86. Chapter 18, you'll find 1 new code here for anosognosia, R41.85. Patients with this condition are unaware of their health conditions or problems, often due to dementia or Alzheimer's. Chapter 19. Under subcategory T45 poisoning by, adverse effect of an underdosing of primarily systemic and hematological agents, not elsewhere classified, there is new code T45, A poisoning by, adverse effect of and underdosing of immune checkpoint inhibitors and immunostimulant drugs, followed by several new 5th and 6th character codes that specify the circumstances of the poisoning, adverse effect, or underdosing. And under T81.32 disruption of internal operation, surgical, wound, not elsewhere classified, there are new 6th character codes, T81.320 through T81.329, to specify the wound location. There are no changes in Chapters 20 and Chapter 22. Chapter 21. In this final chapter of ICD-10, CM, there are new codes for reporting genetic susceptibility to various diseases such as epilepsy and neurodevelopmental disorders, Z15.1, and obesity, Z15.2. Additionally, the descriptor for subcategory Z17 is revised to expand the scope of hormones to include progesterone and human epidermal growth factor and to specify receptor status. Also new for fiscal year 2025. Z51, A encounter for sepsis aftercare. 2 new social determinants of health codes for insufficient health insurance coverage, Z59.71, or welfare support, Z59.72. Several codes, Z67. Point A, category for identifying blood types using the Duffy blood group system. 2 codes, Z68.55 through Z68.56, for identifying pediatric body mass index percentiles. A code for reporting family history of familial adenomatous polyposis, Z83.72, and For codes for reporting the personal history of specific types of colon polyps, Z86.0100 through Z86.0102, Z86.0109. Thank you for joining us for the 2025 ICD 10 Coding and Guidelines Update.